Good afternoon, everyone. I want to welcome you to our Monday press briefing with updates on COVID-19. Tragically, we have lost over 40 citizens in our community. Please join me in a moment of silence for the lives we have lost and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders. First, we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. I'm making a show of wearing the mask. We've been admonished, everybody who's coming to the press conference is going to wear a mask from here on out. Maybe we should have been doing this before. But two things I want to briefly address. The chairman hit on this more than once last week, and the chief has told you, I'm getting calls from people constantly throughout the day reporting violations of the shelter-in-place ordinance. Please, not that I mind taking calls, but what we should do is call the hotline, 302-1900, 302-1900. The Albany Police Department, the Sheriff's Department, and the Dougherty County Police Department are all enforcing Governor Kemp's executive order. And we will respond promptly to any complaints of perceived violations. Also, I continue to get calls from people who are wondering whether or not their particular occupation is an essential business. I referenced this, I think, last Friday when I said that the governor's order basically incorporates the Homeland Security definition of critical infrastructure businesses. I would recommend that anyone who has a question about whether or not you are engaged in an essential business consult the website georgia.org and for further information. The point I want to make today is that finally we have a definite recommendation from the CDC regarding wearing masks. The CDC recommends that the public wear cloth face coverings in public settings where other social distancing measures are difficult to maintain. In other words, if you go to the grocery store, if you go to Lowe's, if you go to the pharmacy, please wear a face covering. Now, there are some recommendations, I'll let the healthcare professionals address it, that actually, if you're out in public, a cloth covering may be preferable to just a regular paper or surgical mask. We've talked about, and we've all learned a little bit about the difference in surgical masks and respiratory masks, but if you have the option, it is recommended that you wear a cloth face covering, and that should be washed as soon as you return home. Again, I'll reiterate, cloth facial masks are intended not so much to protect the wearer, but to help prevent people who are infected, whether they know it or not, from spreading the virus to others. We have a group who are meeting with our big box stores. I think the chairman mentioned that last Friday. There are going to be various recommendations. Some of the corporations, I believe, are taking the initiative to limit the number of people who are in the stores. We applaud that, and of course that is going to create a situation where sometimes there will be lines outside the stores. What the public needs to do is maintain social distancing while you're waiting to get into the store. Also, let us implore you, we know children are at home. We know those children cannot go to the theater, they can't go to the mall, they can't go to parks. Please do not go out as a family unit and shop. One person only. We would ask that stores that are capable of doing so make available some kind of mask at the door for those citizens who, for whatever reason, do not follow our request that we wear cloth face coverings when you go out into public. We know, again, infected people without the symptoms can spread the coronavirus. Simple cloth masks can prevent the virus being transmitted from infected persons when they are buying groceries, picking up prescriptions, at a store shopping, or just in contact with other people. So please, please heed these recommendations, and from here on out, when you go into public, wear some kind of face covering, whether it's a mask or a cloth bandana, but please follow this recommendation for your protection and for the protection of others. Thank you.
Thank you, Mr. Mayor. Now we will hear from Dougherty County Commission Chair Christopher Cohilas. Mr. Cohilas.
Thank you, Chief. Thank you, Mayor. I want to begin by first expressing my condolences for the many, many lives that our community has lost. They're not just in our community and in our county, but also in our surrounding counties. Each and every life that we have lost is precious, and the tragedy associated with it and what the families are having to absorb is tremendous. And we have a tremendous number of families that have had to suffer loss at this time. So I want to sincerely express my condolences to each of you. My heart goes out to you for the suffering that you're having to do in private. Know that we've all been affected by this. So we all have friends, family members, church members, someone that has experienced or known someone that has been lost during this pandemic. I also, as we take the time to mourn the losses in our community, now more than ever, we continue to have to be vigilant. We have to be disciplined. We have to keep our head down and keep fighting. We are making many strides. We have gained a tremendous number of resources here in this community. We have worked hard with our first responders, with our healthcare system, our medical providers. We have tremendous numbers of resources that are coming here to address the issues. We know that at the beginning of this pandemic, we had an 8 to 10 day lag in the testing time. We are now whittling that down each and every day. You're going to hear numbers today. They're going to reflect a large number of test results that have come back. But please understand, when you hear those numbers, understand that it is because we have worked to get the backlog diminished, to make it smaller so that we get closer to real-time testing. That's an important thing for people to understand so that they can appreciate that it's not doubling every 2 or 3 days. What it is we have worked hard with our governors, with the governor's office, with our state, local, and federal legislators, with private companies to make sure that we can get these results in so that we can better put our finger on how fast this is or is not growing in our community. Now, we have to have that data in order to be able to evaluate the impact of the actions that we have taken as a local government, as a community, as a state, and as a region. And we're going to continue to do what we've always done, which is take decisive action. We're going to be prepared. We're going to work together. And it takes everyone in this community pulling their part in order for us to be able to flatten the curve and slow the growth of this virus. Now, with that, I will say this. Every death, one person dying is too many. But we also know some realities about this virus, is that it can be deadly to some and that it absolutely will spread. I was personally encouraged today, and I'm cautiously encouraged by the fact that I saw in some of the data that we've received that the overall number of tests that were administered via drive-through by Phoebe yesterday actually went down significantly. I don't know yet if that is statistically remarkable, but to me, as a person who is looking at these numbers each and every day and seeing the days where we were testing 150, 175 people in a day, For us to experience a day where we only tested 46 yesterday, that's encouraging. We will have to wait and see how our efforts play out over time. We continue to work with the governor's office. We're going to continue to work and comply with his order, which is in effect. As a reminder, that order supersedes all orders that we've previously issued. It is in many ways very consistent with the orders we put in place, and in some ways it is different. I would encourage everyone to continue to call if you are a business who needs clarification on the order and whether or not you are an essential or non-essential business or critical or non-critical infrastructure. Please call the Georgia Department of Economic Development at 404-962-4000. Again, that is 404-962-4000. We continue to evaluate the differences between that order and our local order. That is something that we're going to have to evaluate. We're going to continue to be in contact with the governor's office, who has made many resources available to us, and his help with us being able to get that increased testing capability at Phoebe is a very important factor for our community in being able to determine how widespread this is and how effective our efforts are. I want to reiterate, our Emergency Operations Center is in full swing 7 days a week from 8 a.m. to 5 p.m. each day. Unless you have a true emergency, please do not call 911. If you have a question or you want to report a violation of the order, please call our EOC, 229-302-1900, 229-302-1900. They also have a lot of information about what resources are available with respect to testing, information as to essential businesses, and other information as well. Again, I encourage our local businesses to continue to use best practices. It is going to be incumbent upon you. And I ask you also, don't just look at what the precise wording is and do the bare minimum. If you can do more, do more. We've had some great corporate partners that have established preferred shopping times for our more vulnerable population. That is incredibly important. It helps a community feel safe. And when a community feels safe, it can operate much better. Please, if you can go above and beyond, if you can install sneeze guards, if you can provide masks to your employees, if you can provide the types of lines where people don't have to be bunched in on each other or one-way lines at the grocery stores, these are the types of things that we need our business community to be thinking about, to be figuring out how they can do it so as to provide an environment where people can shop, feel safe, and not feel the risk of being unnecessarily exposed to this virus. That's very important, and I implore our corporate citizens to do that, and I thank those that have already gone have already gone those extra steps. Finally, I just want to say this. I want to thank our healthcare workers and our first responders. We have had so many that have been working at the tip of the spear for so long. We know now, as of the last information that I saw from the New York Times, we are number 3rd in the world, literally behind the Wuhan province, the Lombardy region of Italy. This is ground zero for the COVID virus. But we have people in this community that are literally getting up every single day and saying, I'm going to go into battle and fight for you, fight for me, fight for my neighbors, fight for my community, fight for my church members. That takes incredible courage and incredible guts. And many of you have also become infected during that time as well because you put yourselves at risk. I want to say thank you, thank you, thank you.
Thank you, Mr. Chairman. Now we will hear from our representative from Phoebe Putney Memorial Hospital. Mr. Scott Steiner is the president and CEO of Phoebe Putney Health System. Mr. Steiner.
Thank you, Chief. Certainly from Phoebe's standpoint, this is affecting all of us. We know everyone in our community is hurting, and you're just as much in our thoughts and prayers as we know that we are in yours. So some current numbers since Friday. We've had 573 test results come in. 208 of those are positive, 353 negative, and there were 7 deaths that were confirmed that happened either over the weekend or in prior days that have tested positive for COVID-19. That brings our totals so far to 3911 that are tested. 1,405 of those have been positive, 2,085 are negative, and 48 deceased. We have started to report how many are recovered, and as of today, the number is 340 have recovered. And we have defined that with the assistance of the CDC and others as patients that have been at home who are 14 days past the date of their sample taken that was positive, or patients that have been discharged from the hospital when they are 10 days past discharge, as we've considered them recovered. The hotline has now fielded almost 10,000 calls in 3 weeks that have resulted in almost 1,800 tests being taken. Today in the hospital here in Albany, we have 136 people in the hospital that are positive or that are PUI presumptive, including that, and that is 9 units that we have dedicated to COVID-only patients, with 4 of those being ICUs. Those ICUs are all full today. We also have 100 patients for other conditions other than COVID in our hospital here in Albany today. Some positive observations that we want to certainly make sure everybody that there is light at the end of this long tunnel. In the last 5 days, we have extubated 12 patients, taken them off the ventilator, and they have all successfully been able to breathe and recover on their own, still in the hospital. We have discharged 77 patients from the hospital since April 1st that were positive, and we now consider, as I mentioned, 340 people to be recovered. We're also encouraged that we're expecting 40 new nurses, physicians, respiratory therapists, and other healthcare professionals in this week from a staffing agency. This will allow our staff that have been working nonstop for the last 4 weeks to get a much needed rest. We are very thankful, and there is a lot of thanks. It's hard to, in this amount of time, convey the outpouring of support that we have had at Phoebe from virtually everyone in the community, from prayers, thoughts, goods, meals. Today we had someone donate $720 gift cards to be given out to the staff of our COVID units. So the outpouring of support has been a blessing, and we certainly recognize it. We are thankful for our elected officials here locally and our government officials for your assistance and your support. To Senator Loeffler, Senator Perdue, Congressman Bishop for their concern and assistance. Our state elected officials, including Representative Green, Dukes, Hobson, Yurda, Chokas, and Senator Freddie Paul Sims and Summers. And last, we really want to thank Governor Kemp and his administration, who have been vital for the urgency in bringing forward the full force of the state to help to care for our community here. In closing, there will be much to learn from this event, and we know we are forever changed because of it. What I can tell you is that there is absolutely no fear at Phoebe Putney. We have 4,500 warriors who are battling this virus every second of every day, and the good news is we're winning. There is much work still to be done, but we are heartened by the outpouring of support from our community. Again, we know everyone is hurting, but only God only gives us what we can handle. And we have a saying around the hospital that we've really just started, and it says, it's short, and it says, "Together we rise." And that's how we really feel about this, is as a community, whether it's healthcare, our first responders, our government officials, our elected officials, the folks that live in Southwest Georgia. This is a tough time, but if we stick together, this virus has no chance. So thank you, Chief.
Thank you, Mr. Steiner. And now we will hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz, who is the Director.
Good afternoon. I do want to say that I was listening close to the mayor when he made the comments about the masks, and I agree with him entirely. The main purpose of the mask is to protect the community from us. In other words, if I call for sneeze and I'm wearing a mask, then hopefully any germs that I might have will not be spread around the community. It's also possible that by me wearing a mask, I might be protected from someone else. But the main goal is to sort of seal each one of us off to protect the community from us. And there are lots of creative ways of making your own mask. The internet is full of instructions on how you can do that if you are not able to purchase one that's already made. We have been testing, we have been collecting specimens to test for the community now for about 3 weeks, and we have had several programs, and some of those programs have worked quite well. About 2 weeks ago, we were fortunate enough to be involved with a federal program that provided us with lots of collection kits, and it provided free testing. The downside was that getting the results back was very slow in a lot of cases. And we have really struggled in that matter, but over the weekend we have seen a great deal of progress. I know a lot of folks are still waiting on the results of their tests, people who went to the health department on South Slappy. And the good news is in the last 24 hours or so, we have received hundreds of results. And about an hour ago, we gathered several staff members, and they started making phone calls. And they're going to make phone calls the rest of the day to report these results. They'll be back in starting early tomorrow morning, and we're hopeful that in maybe 24, 36 hours, we will have those results reported. We'll keep making those calls until the results are in. So if someone is listening, and if you're waiting on one of those test results, please do all you can to make sure you answer your phone, even though you may see a number that you didn't expect. We will continue the testing for the foreseeable future, and in fact, we're going to be expanding. Up until now, we have really only collected specimens at the Dougherty County Health Department and in a few other locations in limited quantities, nursing homes and things like that. But tomorrow, we believe that we have everything lined up that we will need so that we can begin collecting specimens in Thomasville, Georgia. And then early next week, we think that we will open up a third collection site in a county that I would rather not mention right now because we don't have all the I's dotted and all the T's crossed, but hopefully in a couple of days we will, and then we will reveal that third location. And because we are doing more and more collections, and because some of our staff members have also been affected by the virus, we are forced to pull back on some of our routine public health services. Things like annual exams, well child checks, swimming pool inspections, and so forth. So please bear with us if you make a call to the health department and discover that some services are being delayed until we see some light at the end of the tunnel. For those who still wish to be tested, I would like to share the number again that you can call, and that number is 229-352-6567, 352-6567. That's the number to call to make an appointment to be tested through public health.
Thank you, Dr. Ruiz. Now, we will hear law enforcement update from Dougherty County Sheriff, Mr. Kevin Spruill. Sheriff?
Good afternoon. Thank you, Chief Scott. About 3 weeks ago, I stood up here and told you about the visitation at the Dougherty County Jail, that my hope and prayer was that Easter weekend we'd be able to regain and reopen that visitation for our inmate population at the jail. But I'm sad to stand up here today and tell you that obviously we're not going to be able to, with this ordinances in place, and plus with the continuing rise of the COVID cases in our area. So we're not going to open it back up this weekend, regrettably. I stand up here and tell you that, and we will continue the suspension of the operation of visitation until further notice. This is my 37th and a half year with the Dougherty County Sheriff's Office. I've been through 2 major floods, 3 tornadoes, and a hurricane, and I've never thought we'd have seen this community as devastated as it has been. I want to echo what Chairman Cohilas said. I want to thank and just praise our healthcare workers and our first responders. I've never seen individuals work as hard as they have, and as he mentioned, work on the front lines. Some of them sick themselves, some of them have family members that have passed, and they have continued to work out there as diligent as possible. So on behalf of the men and women of the Dougherty County Sheriff's Office, I want to thank all of you and commend you. Appreciate you.
Thank you, Sheriff, for your report. Now we will have an update from Dougherty County Coroner, Mr. Michael Fowler. Mr. Fowler.
Good afternoon. This weekend I was working. I haven't taken a day off yet, but this weekend I was working at the courthouse in my office. And I came out of the courthouse Sunday evening late, and my staff was saying, "Mr. Fowler, you got a ticket on your door, on your car windshield." I said, "On Sunday?" So I got to my car, and on my windshield there was a note similar to a ticket, but the note said, "Your service to us is beyond your call to duty. Thank you and your staff for me and all in Dougherty County and Albany, Georgia." That made my day. Times and hours, I'm putting in a lot of hours and time, I know that, but that's fine. One of the things, I know they weren't just talking about me, but they were talking about the EMS, the medical professional, and everyone, the fire department, everyone that putting time in, and many of them have not taken days off, same as I, to keep this thing going on. But one of the things, someone made a statement, the coroner don't have to do all of what he do. Some things I don't probably have to do, but due to the fact I know the need, and I want to be there for the public, because I put myself in someone's situation if I had lost my child or lost my dad or my mom, I want somebody to work with me. Many times the doctors in the medical field, I know they're very busy up on the floor, doing a lot of testing and whatever. I'm assisting them now, trying to make sure that death certificate be filed within a reasonable time, because I know family members are out of work. They need the insurance money, whatever, to get it done. So I'm trying to help get the death certificate signed so the family member the insurance can be processed, because the funeral home, I know they need their money or whatever. A lot of the funeral homes want to know that the patient have the virus before we embalm them, or what we need to do, so we need to let our staff know. So I'm out there trying on the front line, trying to make sure we find out what the person has, so we can educate the funeral director and the embalmer that's going to be embalming the body on what they're dealing with. And many times the tests that go to the lab or even to Phoebe, the lab is not going to call your personal doctor and tell them what your results are. So I'm on the front line trying to figure out what I can do to help get these death certificates signed and get with these doctors. I'm working many hours. My wife asked me when I'm going to take time off. I can't take time off until this virus is gone, until we do something about it. So I'm fighting hard to help, because we have 50 deaths in Dougherty County residents that have died. We have 50 deaths. And I heard someone say one death is too many. Last week we had 38. Now we have 50. What is going to be the end of this week? My thing, we got to practice social distancing and obeying the order what the chairman and the mayor have put out and the governor have put out. If not, we don't want this number to reach 100. But if we don't do what we're supposed to do and keep gathering like some are doing, that number can easily rise. So we had 38 last week. So that's 12 more than from last week. That's scary. So we have no tests pending right now. And that's one good thing, because some of the tests came back negative, but we had, I know, 7 other people that died along with the 5 that came back positive. But I want to encourage you, let's do what we can do and obey and help the virus eventually to pass on. They said it's going to be the worstest week of the virus since we've been involved with it. So I'm going to say, save lives this week by staying in and doing what you're supposed to do. If you need to wear a mask, wear a mask. If you wear a mask, wear a mask. Because we don't know who might be carrying it. Again, I want to say thank you. My prayers, my condolences go out for those 50 families that lives have been lost. Thank you.
Thank you, sir, for your report. I'd like to bring up now for some remarks the Dougherty County Board of Education Superintendent, Mr. Kenneth Dyer. Mr. Dyer.
Thank you, Chief. Those are some sobering numbers that Mr. Fowler just mentioned. My prayers go out to those families and all those who have been affected by COVID-19 virus in our community. Brief update from the Dougherty County School System. As some of you may know, the Dougherty County School System temporarily suspended meal services effective today. That decision was made after we were made aware of a district employee who tested positive for COVID-19. That employee, who works at one of our meal distribution centers in the system, fell ill on March 26th. The employee was initially diagnosed with a sinus infection, but she still did not return to work. After continuing to have symptoms, the employee was tested and was informed Saturday, March 4th, that she was positive for COVID-19. As a result, all of those employees who may have come in contact with that employee are being self-quarantined, and we will not open back up until we able, 1, to get through the self-quarantine period, but 2, get the personal protective equipment that we need. We have masks on. We don't have masks on hand. We have face shields on hand. We have gloves on hand, and we had mask order. They're on back order. Initially, we were told they'll be in mid-April. Right now, they've been back ordered even longer, and we're trying to source masks from other locations. When we ordered the masks weeks ago, they were not required or recommended by the CDC nor by the Georgia Department of Education School Nutrition Guidelines. Since the revised recommendations by the CDC as of last Friday that requiring or recommended everyone wear masks, we think it's imperative that we provide masks for our employees, provide for their safety as they prepare meals and deliver meals to students in the community. And the decision to suspend services was not taken lightly. We're well aware of the food and security issues we have in our community. Since March 16th through last Friday, we delivered 162,000 meals to youth in our community, and we know that's going to be a hard resource to replace. So we want to get back in operation as soon as we possibly can. However, we have to balance the need to deliver these meals with the need to provide for the safety and security of our employees as well as the students we've been serving. Now I want to thank those in the community who've offered to volunteer their services to prepare meals for our students. That's heartwarming, and I'm not surprised, because I know that in times of need, citizens in Dougherty County come together to help one another. The issue right now is not really staffing. Even if we have volunteers, we wouldn't have masks to put on those volunteers to ensure their safety. So the critical need right now that we have is securing masks for our employees and those others who will be serving meals to our students. We'll continue to source masks. We're working feverishly to get those items secured so that we can begin providing this invaluable and much-needed service in our community. Thank you very much.
This concludes today's press briefing. Thank you, Superintendent, for your comments. As we close, let's all remember to continue to stay strong. Continue with what you're doing with protecting yourself, your loved ones, and our community so that we can all stay safe as we get through this pandemic together. God bless each of you, and we will see you back here on Wednesday at 1 p.m. That concludes our press conference.